Introduction. So problem is in the research topic and we have to find it, which will interest us. So what's the problem? Problem can be treatments that did not give the desired results, materials that don't work in some patients, why they don't work, some patients who don't respond to certain treatment while all others respond. So we have to find out which patients don't respond, complications of a treatment or way to reduce. And all these things are problems, and all things which can be improved show us that there is a problem, which can improve our understanding, which can improve the life of a dentist, which can improve the life of a dental patient. All those can become problems. So a gap between what is known and what is unknown can be phrased into a problem. No problem, there's no going to be any research. So where to find this problem to solve? It can be your interest or based on your prior experience. So you can find your research topic of interest, or based on prior experience of working in some field, you can choose that area. Search for the problem in the research topic. It can be done through a literature search. So identify if there is an issue and search in the literature if the problem has been described or any solutions has been put forth. If research are already available that solves the problem, you can search for future directions to focus on the problem or finding new solutions for it, or expand the context of the problem to look for other areas in other populations, or search for a new problem from scratch. So examples, as we relate to our earlier examples, in general dental practice, a problem could be like a non-compliance of patients to antibiotic regimen, and you can find a solution to explain why there is a non-compliance, or to devise some strategy which can improve the compliance. In clinical dental education, a delayed learning of history taking skills can be a problem, which can be improved by finding strategies to improve them. Smoking and oral health. Smoking affects periodontal health. We can find how much of smoking can affect the periodontal health, or how to avoid the destruction due to smoking. Anesthetic complications, oral ulcers after mepivacaine injections can be a problem. So why do we need to state the problem? To align to a research topic. To understand the importance of the research, we need to state the problem. To make the audience get interested into the problem and to understand why this research is important, we have to state the problem. How the intended research will contribute to the literature and to find solution would be possible when we state the problem, or in simple as such as why do we need to do this research, justify the need for the research can be understood by stating the problem. So writing the problem, how to write the problem? So how to write the problem? Start with an issue in the topic that could relate to the reader's interest as in simple language. There are no idioms or codes in the research problem when you state it. There can be numerical factors can be given which gives an impact. For example, let us say in last year there were 2000 road accidents and 20 of them fatal in the city of Semantic. So this could excite the reader's interest that there is a definite problem there. And also please don't be ambiguous in the statement and clearly describe the problem. Provide references to any facts to authenticate the importance of the problem. The statement should be phrased so it gives an indication of the study design also. Example. Early childhood caries affects 5% of children below 5 years and is a major problem. Sugars are a major cause of this condition, according to a reference by Shix et al. 2003. But the exact types of food and the levels of risk is not known. Now, I have given an introduction into how a problem can be. Next, what you have to do is we have to review studies on the problem. We have to make sure that the problem doesn't have a solution and still is a problem. And what are other studies which have studied on the problem for us to understand. So this introduction has a section that reviews select studies that explain the importance and significance of the problem. And remember, it is not a complete literature review which would be followed following the introduction. This would be a composite review from a group of studies than individual studies being reviewed. The aim is to tell the readers what is the status of the problem now. It also distinguishes past studies from the proposed research and establish that it is unique and unexplored yet. The short review should also show how the information can explain the overall context. Reviewing on problem, It should be a review from a group of studies and reference should be in recent literature. Recent literature I mean is about 5 or 10 years old. If it is very old, then there is a question of saying whether the problem is still relevant today or not. Example of a statement problem further refined. Many studies evaluated association of sugars to dental caries and found some results according to few studies. Studies by Sheehan et al. Found that the risk of eating sugars increased the risk for caries by more than fivefold. However, there is disagreement on the type of food that are most dangerous. So, what the proposal would be like to find what type of food are most dangerous. Further, review studies should be done on deficiency of the explanation of the knowledge. This would lead to a justification for the new research. This section comes next to identify the deficiency that required this proposed research, or rather how the problem was arrived at. This presents the justification for the need for the proposed research. Areas not addressed by previous research can be highlighted as potential areas for research, and one of you can become the problem of interest. New challenges or research in new population or in different contexts can also be a new problem to be investigated and should address how the proposed will address the deficiency of earlier studies. When reviewing on deficiency, identify and cite several deficiencies that will make a stronger case for the proposed research. Be very specific in highlighting the deficiency that brought on the need for this research. It can be like methodological flaws, different populations, or the earlier study used a convenience sample which is not very valid and reliable. Other areas not studied at all like new analysis and new variables which are being introduced and how the proposed research will address or till what extent it will address. Further, significance to the audience. The justification should also address how this will be significant for the audience who could be clinicians, academics or researchers, policymakers, industry people, and also how this proposed research can address the knowledge gap in relation to them. They have to understand how this research is important. Example, further refined. The problem has been further refined. However, there is further disagreement on the type of food that are most dangerous in causing dental caries. The increasing use of alternative sweeteners might affect the caries incidence and has not been explored. The proposed study on middle income Malaysians are a good population due to the popular use of these types of studies. The audience garnered here would be the policymakers in Malaysia, the clinicians in Malaysia who would be interested as it relates to their dental patients. Examples of a problem statement. In general dental practice, where non-compliance of patients to antibiotic regimen has been seen as a problem. So we state in such. Research shows that 25% of dental patients prescribed with antibiotics fail to complete the full course of medication. According to Tyler et al., non-compliance to antibiotics can lead to treatment failure or increase in antibiotic resistance. I am giving the importance of this problem. Identifying factors related to non-compliance of antibiotic regimens by patients can help design measures to prevent or reduce the problem I have justified. Let us do a small activity, continued on the previous one. Based on the topic selected, identify the problem and review related studies. Find what is lacking or has not been done in the studies related to the problem that you have reviewed and make a problem statement of what you would like to do as a research. Use the same Word file used in previous activity and send it to me for feedback. If you do not have the Word file, please scan the QR code to access the Word file. Pause the video to scan.